Bismillahirrahmanirrahim. I am Dr. Yasmeen Ahmed, and today's our topic is about the ischemic heart diseases, also known as the coronary artery diseases. So previously you have studied about the heart failure, the left-sided heart failure and the right-sided heart failure, and now we will start about the ischemic heart diseases. So what do you know? What do you mean by the term ischemia? Ischemia is basically the inadequate blood supply to the heart. And when we are talking about the blood supply to the heart, so blood supply is basically maintained by the coronary arteries, and when we'll see the coronary circulation, what happen in it. So it's basically the circulation of the blood in the blood vessel of the heart muscle known as the myocardium. So this is the coronary circulation, and it will involve the arteries, the right coronary artery and the left coronary artery. So as you know that these arteries, basically the coronary arteries, when they run on the surface of the heart, they are called as epicardial coronary arteries. When these coronary arteries run deep within the myocardium, it is referred as subendocardial arteries. So these coronary arteries are also termed as end circulation or end arteries because they represent the only source of blood supply to the myocardium, mean that there is very little redundant blood supply, which is why the blockage of these vessels can be so critical and crucial. Okay, and myocardial ischemia. Myocardial ischemia, it occurs when there is imbalance between the supply of oxygen and the other nutrients and the myocardial demand of these substances. So there are basically some causes of this inadequate blood supply to the cardiac muscle. So those causes may be, first cause we will see that there is reduction of blood flow to the heart that can be caused by the stenosis because of the narrowing or spasm or the acute occlusion by an embolus of the heart arteries. There may be the narrowing of the artery or the blood vessel, and there may be the acute occlusion blockage due to the atheromatous plaque present in any artery of the heart. And the second cause, we will see the resistance of the blood vessel, and this may be caused by the narrowing of the blood vessel. So there will be decrease in the radius, so there is decreased blood flow. As you know that blood flow is proportional to the radius of the artery to the fourth power. So when there is reduced blood flow, you can see there is increased resistance of the blood vessels in the blood vessels. And the third cause of this myocardial ischemia is reduced oxygen carrying capacity of the blood. It's due to the several factors such as decrease in oxygen tension and hemoglobin concentration, and this decreases the ability for hemoglobin to carry oxygen to the myocardial tissues. Okay, now when we see about the any kind of obstruction, or when we see about the occlusion, mechanical obstruction of coronary blood flow to the myocardium, that is caused by the atheroma. So it's an atheroma. What you mean by the atheroma? Basically, it's an accumulation of degenerative material in the tunica intima, its inner layer of the artery wall. Okay, there are three layers, and this is the innermost layer of the artery wall known as tunica intima. So accumulation of degenerative material in tunica intima, the material basically consists of mostly the macrophage cells, debris containing the lipid, cholesterol and fatty acid, calcium and variable amount of the fibrous connective tissue. So these accumulated material form a swelling in the artery wall, which may intrude into the channel of artery, causing the narrowing it and restricting the blood flow. So this is basically the atheroma or the atherosclerosis. You can see this is a vessel wall. In the innermost layer, the tunica intima, there is fatty deposit. You have seen the thick deposit, due to which there is resistance in the blood vessel and there is decreased blood supply. The normal artery you have seen, this is the normal artery, and on the right side you are seeing that in which there is lipid deposit of the plaque that causing the narrowing of the artery. and narrowing of these arteries because of the lipid deposits of plaque is known as atheroma, and that process is known as atherosclerosis. Okay, basically this coronary artery disease or the ischemic heart disease are basically the group of heart diseases that causes the narrowing of coronary arteries and leading to inadequate blood supply to the myocardium. So these diseases include, first of all, the angina. Angina have further subtypes. You don't need to memorize those subtypes. Stable angina, unstable, just maybe knowing the names of these angina, the stable angina and unstable, and myocardial infarction and the coronary death, sudden coronary death. Okay, when we will see the pathophysiology, basically we have again studying it that there is again the limitation of blood flow to the heart causing the ischemia, in which there is cell starvation secondary to the lack of oxygen of the myocardial cell, and myocardial cell may die from the lack of oxygen, and this is called as myocardial infarction. And this myocardial infarction is also known as heart attack. So it leads to heart muscle damage, heart muscle death, and later myocardial scarring without heart muscle regrowth, as the heart muscle cannot be regrown. So chronic high-grade stenosis of coronary artery can induce a transient ischemia, which lead to induction of. There are further complications in the ischemic heart diseases, that maybe there would be ventricular ventricular arrhythmia, and that can terminate into ventricular fibrillation, leading to that. In the next lecture, you will see, you will be able to appreciate the different types of arrhythmias. So these are basically the complication when this whole ischemic heart disease may be complicated, that may lead to the different kind of arrhythmias, and the most severe form of arrhythmia is the ventricular arrhythmia, ventricular fibrillation. Okay, there are further okay, there is again a picture showing that the coronary artery disease occur when the part of the smooth elastic lining inside the coronary artery develops atherosclerosis, and the artery lining becomes the hardened, stiffened, and swollen with calcium fatty deposits, and there is abnormal inflammatory cells to form the plaque. You can see in this diagram as well, showing the atherosclerosis. Okay, there are some risk factors for the ischemic heart diseases. Risk factors include, you just be knowing about the risk factors. Hypertension. Hypertension means both systolic and diastolic are increased. Blood pressure, and there would be patient of diabetes mellitus. It also increases the risk of coronary artery disease or the ischemic heart disease. High blood cholesterol level. Age, as in the advancing age, there is increased risk of ischemic heart disease. Gender mean men have higher incidence of these diseases as compared to women. And family history, there may be a smoking present in the risk factor. Diet and obesity, like the sedentary lifestyle, and psychologically well-being. Okay, there are some kind of risk factor that may contribute to any kind of ischemic heart diseases. Okay, now we will see about what does the angina mean. Angina is also known as angina pectoris, and angina pectoris, as you know, known as normally named as angina, is a sensation of chest pain, pressure, or squeezing often due to the ischemia of heart muscle from the obstruction or the spasm of coronary arteries. So this is a proper definition of angina pectoris, in which you see the sensation of chest pressure, chest pain, squeezing effect, and it's due to the ischemia of the heart muscle from the obstruction or any kind of spasm of the coronary arteries. Okay, this a person may feel the strangling effect of on the chest. There may be a tightening sensation, and the cause of this angina is main cause, and we are already studying in this topic in the coronary artery disease or in the ischemic heart disease. So the main cause is coronary artery disease or the ischemic heart disease. And the second one, an atherosclerotic process affecting the arteries leading to the heart failure. So atherosclerotic process may be present, and the third cause is it can derive from the anemia as well, cardiac arrhythmias, and the heart failure. So these are some causes of angina pectoris. These are the further classification of angina. You don't need to memorize it. You just be knowing about that there are further classifications, stable and unstable, and the other angina. But you don't need to memorize it. Okay, again we're telling about myocardial infarction, is also known as the heart attack, and it occurs when the cardiac myocyte die due to the prolonged myocardial ischemia. When there is prolonged activity of ischemia, the myocytes, yani कि cardiac cells, die because of it. And damage is basically the permanent, because the cardiac muscle cannot regenerate and the dead muscle is replaced with the non-functional fibrous tissue. So the symptom of basically myocardial infarction is following: anxiety, cough, dizziness, tachycardia, pain in the chest lasting for more than 20 minutes, and when you are giving the patient to the sublingual glycerol trinitrate, that is not being affected, and the pain radiates basically to the arm, back, jaw, and there is shortness of breath, dyspnea, fatigue, pale and sweating and vomiting. These are the some symptoms of a heart attack in a patient suffering from myocardial infarction. Okay, now we will see about the other type of disease, other type of heart disorder, that is known as the rheumatic heart disease. Okay, rheumatic heart disease is basically an immunological disease, or it may be known as a autoimmune disease, and it is characterized by the valvular damage or dysfunction followed by one or more episodes of rheumatic fever, and that's caused by the pharyngeal infection with group A beta hemolytic streptococci. So it means this is an basically autoimmune disorder in which there is complete valvular damage, or there may be a dysfunction of the valves of the heart, and that may be occurring because of the one episode or more than one episode of the rheumatic fever, and that rheumatic fever basically occur because of the pharyngeal infections or the throat infection because of the group A beta hemolytic streptococci organisms. So rheumatic heart disease is basically the permanent heart valve damage resulting from one or more attack of acute rheumatic fever. You will later study about this rheumatic fever in some other chapter, and it is thought that 40 to 60% of the patient with this acute rheumatic fever will go on to develop this rheumatic heart disease. Sadly, this rheumatic heart disease can go undetected, with the result that patient present with debilitating heart failure. Okay, in this rheumatic heart failure, you can see that the result of there is damage to the heart valves which occur after repeated episodes of the acute rheumatic fever, and the order of frequency of involvement basically depends on the stress placed on the various chambers. So mitral valve is mostly affected, as you have seen in the picture, that 65 to 70% mitral valve is affected, and after that mitral valve, aortic valve is most highly affected, about 20 to 25%, and tricuspid and pulmonary valve is less likely to be affected. So The antibody is basically produced to combat original infection, and these damage the connective tissue including the heart, joint and skin in this rheumatic fever. So in this valvular damage occur, the valve incompetence is more than the stenosis. Means valve incompetence means the regurgitation. Okay, we will see the pathophysiology of this rheumatic heart disease. There is a causative agent, basically the group A beta hemolytic streptococci, that causes the throat infection, that causes the pharyngeal infection, and when that untreated throat infection carry on, that causes the rheumatic fever, and when that rheumatic fever is prolonged, it causes damage to the various connective tissue, the heart, joints and skin, and after that it affects all the layer of the heart, and the mitral valve become inflamed. And when these all layers and mitral valves become inflamed, so there is vegetation forms. Vegetations are basically the abnormal growth present on the valve surface. So vegetations are formed, and that causes the valvular regurgitation and stenosis. Valvular regurgitation basically known as also the incompetence, valve incompetence, and stenosis mean the narrowing of the valve, and that would finally be leading to the heart failure. So when we will say that there is acute rheumatic heart disease, and when we say that all the layers of the heart wall are inflamed, that condition is known as pericarditis. And the heart valve, especially mitral valve, frequently affected. So the fibrotic nodule develop on their cusp, so which shrink as the age, distorting the cusp and causing the stenosis and incompetence. So that fibrotic nodule basically present on the cusp are known as the vegetations. So when this inflamed myocardium fails, that would lead to the sign of heart failure. And heart failure sign includes the tachycardia, breathlessness, and the cardiac enlargement also. So permanent fibrotic damage may fuses also the visceral and the parietal layer of serous pericardium together, and restricting the heart action of pumping the blood. So in chronic rheumatic heart disease, it has been written in your textbook, Ross and Wilson, that half of these acute cases develop the chronic valvular incompetence following the recovery, and majority of the patient have basically, again we are saying that mitral valve damage is more, but aortic valve is also frequently affected too. Okay, these are some clinical signs, as I have already discussed with you, that there is valvular damage. You can see the murmur as well, and the murmur is because of the mitral valve incompetency, mitral or aortic regurgitation. Endocardium is involved, and there is increased cardiac enlargement. When that cardiac enlargement is known as cardiomegaly. Myocardium is involved again, and pericarditis, all layers of the heart wall is become inflamed, and the myocardial inflammation affecting the electrical conduction. So these are some clinical signs present in the rheumatic heart disease. You can see here that valve involvement. First picture you can see the stenosis, and the second you see the regurgitation. Stenosis because basically the narrowing, and the narrowing of the valve, and in this the valve does not open all the way, not enough blood passes through it because of the narrowing of the valve, because of any presence of any fibrotic nodules. And in regurgitation, you may see the picture, valve does not close all the way, so blood leaks backward. So this is regurgitation, is also known as the valve incompetence. And in this rheumatic heart disease, basically the mitral and the aortic valve incompetency occurs. And this is because of the rheumatic fever, and that rheumatic fever basically comes from the group A beta hemolytic streptococci infections. Again, we were talking about the valve involvement. Basically, the mitral valve affected in 60 to 70% of cases. Mitral regurgitation most commonly found in basically the children and adolescents, and mitral stenosis represent longer term, basically the chronic disease in adult, and most common complication is mitral stenosis and the atrial fibrillation. Aortic valves also next most important commonly affected, associated with disease of the mitral valve, and it's basically most common and serious in the elderly population. Tricuspid and pulmonary are really involved, and you can see the much less commonly affected, and usually affect very severe rheumatic heart disease when all the valves are affected. It basically are affected when all the other valves are also affected. So there are some complications of this rheumatic heart disease. Congestive heart failure, it can complicate to this heart failure. Infective endocarditis, we will see this infective endocarditis now. And arrhythmias you will study in your next lecture. And embolic episodes, there may be any block or embolism present. And there is cardiomegaly, means the there is enlargement of the enlargement of the heart. Basically, that's known as a cardiomegaly. Okay, the other term we will see the infective endocarditis. Infective endocarditis basically is due to the microbial infection of cardiac valve or the endocardium basically, and it caused by the bacteria, fungi or chlamydia. So in this, pathological finding includes the presence of valvular vegetation, again the fibrotic nodules present on the valves that may contain the bacteria, fibrin, inflammatory cells, and this is often valvular. It causes the valvular destruction with the extension to the adjacent structure. You can see in this diagram as well. Vegetations are present at the mitral valve, means abnormal fibrotic nodule are present. So this is infective endocarditis. So etiology means the cause, and the normal heart is basically less resistance to infection, and when bacteria and fungi do not easily adhere to the endocardial surfaces, and constant blood flow helps prevent them from settling on the endocardial structures. So there are basically the two factors required for this endocarditis. And endocarditis term includes the inflammation of endocardium, and the two factors are basically required for this. Means a predisposing abnormality of endocardium, mean any abnormality already present of the endocardium, and the second one, microorganism in the bloodstream. And the microorganism in the bloodstream, if that is present, that's known as a bacteremia. That condition is known as bacteremia. So there are other causes as well. High risk groups. High risk groups are basically the IV drug abusers. The person who are IV drug abusers are 60-fold at much risk to cause this infective endocarditis, and the males are basically 3-fold at higher risk than the females. And prosthetic heart valve, in the person who is having artificial, or that's known as artificial heart valve, is known as a prosthetic heart valve, that is also at a higher risk. And the dental work that gone wrong, and any type of congenital heart disease or any hypertrophic cardiomyopathy. So these are some causes that can risk to the infective endocarditis. So there are some bacterial causes, and in that bacterial causes there are some bacteria, Staphylococcus aureus. That Staphylococcus aureus causes the endocarditis, and that Strep viridine causes endocarditis. And there are, you don't need to memorize these bacterial names, but you must be knowing their names. There are Staphylococcus aureus endocarditis, and there is Strep viridine endocarditis. And when there is a fungal reason behind that endocarditis, that would be definitely the Candida albicans endocarditis. Okay, again we will see that what population is at higher risk, and we already taught you that the rheumatic fever history, when the person may have a previous rheumatic fever history, and there may be a person going through hemodialysis, and there may be a previous history of endocarditis, or the patient with prostatic artificial valves, and the IV drug abusers, 30% risk within the 2 years. So these are some condition or causes that can risk to the infective endocarditis. So again, we are saying that again in men it's more common in age 50 years, and so you can see that incidence increases with age, probably because due to the increased cardiac disease, and due to the increased cardiac disease, and there is decreased immunity in the elder age, and prostatic valve infection are basically increasing. So in this you will see the basic physiology of this infective endocarditis. When you see there are some predisposing factors, and these predisposing factor also include, and we have just seen that there are two factors. The first factor, we have seen any prior condition, any disease of that endocardium, or there may be the microorganism in the bloodstream known as bacteremia. So when we see that there is a bacteremia condition, the microorganism present in the bloodstream, that would adhere, so that would cause the adherence of the microorganism to the endocardium and the valve surface. This will lead to the bacterial growth and multiplication, and that bacterial growth and multiplication causes the fibrotic nodule or abnormal growth on the valve known as vegetations, and that vegetations abnormal growth includes the fibrin and platelets accumulation as well, and this fibrin platelet vegetations further goes to the fibrin thrombosis, causing the calcification, and that calcification undergoes the valve destruction and embolization. That may be the simple valve destruction, or there may be the embolization, and the symptom depends on the affective valve, which valve is affected, the aortic one or the mitral one, and that would lead to the heart failure. So this is the physiology of this infective endocarditis. As I have told you earlier, that there are the two factors required for the endocarditis. The first one is the predisposing abnormality of endocardium, and the second one are the presence of microorganism in the bloodstream, that's known as the bacteremia. So if the bacteremia is present, that causes the adherence of the microorganism to the endocardium and valve surface, and there would be bacterial growth and multiplication leading to the fibrin platelet vegetation presence, and that would cause the fibrin thrombosis calcification, and that calcification leads to the valve destruction or embolization, and further leads to the heart failure. So there are further two types of infective endocarditis. There is further classification, the acute one and the subacute. So acute infective endocarditis involves normal heart valves. Basically, it's rapidly destructive. Metastatic foci, metastatic means that involve the other parts as well, and commonly due to the Staph aureus bacteria. And if it's not treated, usually fatal within the 6th week. And so in subacute type, you will see that it often involves the damaged heart valves, and it's indolent in nature. If not treated, usually be fatal by the 1 year. So this is all about the today's lecture. You can see in your book as well that infective endocarditis factors, predisposing factor for this infective endocarditis are bacteremia, depressed immune system, or the heart abnormalities, and that would further lead to the acute subtype infective and the subacute. Okay, this is all for today's lecture. Thank you so much. Allah Hafiz.